in 2020,
Yeah.
we were told as healthcare professionals that, look, there is this virus that is emerging in China, and then it spread to Italy, and we saw the massacre. It happened, and we were told. I remember I was sitting in a big board meeting, and we were told that they did some modeling in Department of Health or somewhere, and they estimated that almost 1 million people could die from COVID in the UK. And as healthcare professionals, we were just looking at each other to say, my God, how can we do our part to save that?
Yeah,
Right?
yeah.
So everyone was scared.
Yeah.
You have to understand, like, it's not the fact that, oh, we are healthcare professionals or doctors or pharmacists or nurse, we would know what to do.
Yeah.
Like, everyone was scared for their life, but we still turned up every single day and we tried to see what can we do for the patients who've come in who are completely helpless, right? And that's where your role even became more important, because we were looking for other drugs. We were looking for, okay, what can we give to patients that's going to save their lives? And whatever people say about vaccines, right? Oh, it causes injuries. It was all wrong. It's fine. But at that time, in that phase, we wanted anything and everything that would come to us that's going to help us save patients. And at that time, vaccine was the flavor, right?
Yeah.
And you got lumped with so many studies to say, these are the new vaccines, you have to try it. So there you are with your full-time job, with your MBA degree, and you were leading the vaccine studies there as well.
Yeah.
What was that like?
Thank you for asking that. I mean, it's been
Personally, like,
it
what was that
already-
like for
It
you?
already feels like it was a while back, right? And it's nice how you started with the COVID story as well. We are going to take names, so we're going to do another big shout out
Keep
to
it.
Dr. Sanjay Bagani.
Professor Bagani,
He's
come to the podcast.
Exactly. I think he should be your next guest for sure. I think you should definitely have him on this podcast for sure. But I do remember when the pandemic unfolded, Abby. I mean, it's not just my role. Everybody who was in healthcare center at the time, right? And Sanjay, he's been on BBC program around
Yeah.
it as well, and he's one of our leading ID professors and leading on this COVID amongst many others at the Royal Free.
He did great.
And we had a few first patients at the Royal Free. Do you remember that?
Yes.
In one of our wards?
Yes.
And it was
We had-
few.
Can we say it now? I think we can. We looked after one of the very first
Exactly.
COVID patients
Exactly.
in the UK.
Yeah, we're the leading trust, and we've got one of the first patients here. And I do remember trying to, I'm sure you remember this as well, catching up with Sanjay afterwards about like what is unfolding, like what do we know about the disease and how it's doing. And because COVID was just like, it was a random selection. Nobody knew who's affecting the most
Yeah.
or who is going
At
to
that time, we
survive
knew
it,
nothing. We
who's
knew
going to
nothing.
feel it like a cold and then they're going to be fine, and who's going to need these ventilators and go through that whole journey that they did, right?
It was so
It
difficult.
was so difficult.
It was so difficult.
all unfolded in a matter of weeks. Things started changing and changing.
Too quick.
And we were at the center of it. Like we were seeing it
Yes.
from a hospital's
Yes.
perspective, right? And that was scary.
Scary.
It was so scary. I
Yeah.
think that was my first thing. Like I was scared for my family,
Yes.
our parents.
Yes.
And slowly the whole story around Asian
Yes.
people with diabetes and
Yes.
blood pressure,
Obese,
obese,
elderly.
and come on, I'm so Asian and I've got very Asian parents, and you name all these
We were
diseases and they
scared.
have it.
Yeah, yeah, yeah.
And now you're so scared for them, right? Yes, and all of that was unfolding, and it was just at a speed that was unmanageable
It was
to
insane.
maintain.
It's
or
unlike
control.
NHS has ever seen.
Nothing
terms
like
of
it that
speed,
you've seen,
yeah.
right? But I haven't personally at that time getting involved, I haven't felt more pride
That's right.
in my job,
That's right.
in my colleagues, in my friends around me at the time,
Yeah.
in the NHS. And I felt an insane amount of pride for what we're doing and where we are, and what are we contributing, and how much we're going above and beyond to actually do what we need to do at the time.
We fought hard.
Yeah, and I come from managerial sector, which is, and I acknowledge it, but I worked very closely with these consultants and these doctors and pharmacists.
Yeah, yeah.
You, Abby, and the nurses. Oh my God, I was so proud of them.
Yeah.
So that was the
Yeah,
immediate
yeah.
thing, right?
Yeah.
But then, yeah, we needed a fix. We needed a fix, and we needed it quick. And we needed a new invention. I think COVID did lead to, and we can talk about this, innovation quite
That's
a lot.
right. Yeah.
Quite a lot. Like
Yeah.
as in, and I think that's when we stepped into, there was a sense of like a work that I need to do this. I've been selected by one of the consultants, which is Fiona Burns, Professor Fiona Burns.
Shout out to Professor Fiona Burns.
Phenomenal
Yes.
person to work with, alongside Margaret Johnson, for example. These are the likes, and I'd like to say these names because they did contribute huge amount,
Of course.
right? And it was these guys coming together and coming up with these ideas that we need to do something,
Yeah.
right? And that's where, yes, I did work incredibly closely
Yeah.
with Fiona at the time to build up, because we didn't have a center.
Yeah.
We didn't have the resource.
Yeah. Tell me about that.
Yeah, we
Like,
didn't
how
have
did
the
you?
okay, so we had zero, like nothing. There was no resource.
Wow.
We had no idea where to start, right? How much are we given, for example?
Money.
But
yeah.
but few of these stakeholders that I mentioned, they were adamant we have to run it at the Royal Free because we don't have this. And UCL had it, which was just down the road from us. So I remember having a visit at the site just to understand the logistics and operations of it. And then myself with Fiona at the time, we took that task on, like, right, we need to sit down with R&D and we need to plan it. We planned it from scratch, basically,
Insane.
in terms of this is the amount of money that we need, this is the amount of resources that we need. And we had to recruit a huge number of participants in such a short time frame. That was scary at the time. Like, how do you make sure that everything is done robustly and safely?
And how do you keep the morale of the team as well?
Morale of the team and get everybody together. But I mean, I think one thing that COVID has taught me, and around that time and that whole experience, that NHS doesn't lack intelligent people.
Yeah.
Yeah, they're full of innovative people.
Yeah.
And when suddenly all attention was at COVID, now trials are setting up at Godspeed, like
Yes.
so fast.
Red
We
tapes are
can do
gone.
it.
Yes.
So we
Bureaucracy
can
is
do it,
gone.
right?
Yes. Yes.
Right?
Yes.
We're allowed to think outside the box
Yes.
to create efficiency, so we can do it.
Yes.
Right? There was funding that was coming and we were generating it
Yes.
through that. So it was all achievable. And I feel like the morale kept high because people saw output.
Yes.
There was an output that was getting produced from the work that they were doing.
Yes.
Right?
Yeah.
And that's NHS. And I feel like NHS does run on a lot of
Yes.
like intrinsic motivation that they have, all our staff. But again, we need to learn to look beyond it and above it. So
I
yeah,
think
it was a
Yeah, you guys worked incredibly hard, and every name that you've given, I am just so proud to be associated
Yes.
with those people. And you just literally hit the nail on the head, because I was so surprised to say, wow, the speed, the efficiency with which we were trying to see patients and actually generate those outcomes, it's all there.
absolutely.
You know, like and
Absolutely.
those red tapes, they don't need to be there, you know. But were you worried about speed versus efficiency at any point?
I think everybody was.
Right.
I think it would be not fair to say that we weren't as part of delivering to these clinical trials. And we had, for example, like you talked about the time that clinical trial takes from drug idea to actually marketing. It's 15 years.
15 years.
And now you turn that into like within a year and a half. It's a big speed that we're
Yes.
working at. So of course, and I think, but then that worry keeps you excited to make sure you're doing the right thing. Make
Yeah.
sure you are forming the processes that are safe for our patients. Make sure we have enough personnel to collect that data that we need to collect. So actually then create a very informed decision about these vaccinations, right? So yeah, the worry was there, but then we needed to work even harder to make sure that we're giving the attention that all
That is
these
required.
incredible participant required,
Yeah,
because
yeah.
it took a lot of bravery and you needed these
Yes.
participants. If without
Yes.
them, you couldn't have done this.
Yes.
But I think I was mind blown by the efficiency and the innovation during pandemic. And I know you touched on it. I think a lot of people do speak about all the negative. And Abby, I'm not a clinician and I haven't worked on the clinical side. So I wouldn't say informed, but I'm not qualified enough
Yeah,
to
yeah,
answer
yeah.
intelligently to that part.
Yeah, yeah, yeah.
But from clinical trials perspective, I think I saw great innovation, and I thought this is what we need to do.
Yeah.
This is how we need to continue to grow.
Yes. I think what happened is after COVID, the voices that were on the negative side actually grew very louder. And people who were within the NHS didn't really say a lot. Is
Yes.
that behind every healthcare professional's title, there was a human being
Yeah.
that was trying to help their fellow human being and
Yes.
trying to save them from dying.
Yeah.
You know, I saw some doctors literally doing 14 hours, 15 hours, 16 hours, going home, sleeping for a bit and coming back. You know, there was a stretch where I felt like I was at home at all because I was constantly either on my phone or I was at work. And there are like so many examples of like nurses, doctors, like we worked so hard
Yeah.
to try and save so many lives.
Yeah.
And that I feel like nobody's out there just saying it out loud enough
Yeah.
to say that you can talk about all the negative stuff. We can talk about where did the COVID come from and thing. But to us, it didn't matter at that time. What
No.
mattered to us was thousands of sick patients who were on the ward and what can we do to help,
Yeah.
hoping that
Yeah.
somebody would do the same for us.
Exactly.
You know?
Exactly.
What a time. COVID was
It
insane.
was. No,